Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years and now doing the brokerage for 15. Today's topic is, how should you, when selling a dental practice, how should the seller communicate to the buyer valuable information and how to avoid unnecessary information and how long. We'll get into that. So as you know, we now have 10 employees. We're in 25 states, leaving for a meeting in Chicago, dental meeting. I think that's the Becker's one. We're going to that on Monday. Tuesday, they want us to become some kind of observer, reviewer, whatever, which is we'll help them out. And then we leave for Utah. We're going to hit Arizona and go to Yuma, I think it is, and then shoot up to like 6 places in Utah. Really excited. The trip from Phoenix, after we come out of Yuma, Phoenix, to Salt Lake City, which I've done once before, is a magnificent, spectacular trip. I'm really excited about this trip. So we'll see how it goes. But really, we'll keep you posted what we find out there. Now, continuing along, everything you're about to hear is for entertainment purposes. We work 363 days a year, taking off Christmas and Easter. So call us. We are available, even if you want just a free free consultation, whatever. We'll talk to you. Keep us posted. Anyway, so give us a ring at that 201-663-0935 and the website dentalpracticeguide.com, or the other one in case that one's not working, nationwidedentalpracticebrokers.com. So if you are thinking about selling a dental office and it's a large one, possibly one of the alternatives is sell to a DSO, large DSO, dental services organization. They do pay more money, but they hold money back, and you've got to stay 3 to 5 years. So there's a lot of possibilities there, but they do want you to stay on. And when they're holding money back, generally a portion of that is stocks. There's a little bit of a chance. But we work with them, work with about 140 of them around the country. They pay our commission. Well, if we go to closing, they'll pay our commission. And if you have a practice that sells for over $1 million, we will pay your legal fees. We'll reimburse your legal fees based on some minor criteria, but we'll reimburse your legal fees. We've done that often in the last 3 months, actually, 3-4 months. So let's get on this topic. How do you conduct yourself as a seller? Do you want to do all the talking? Do you tell me? There's a couple of key points. One of them is, how do you take this practice to the next level? What do you have to do? And you can go over the areas that you're not pushing as hard. For example, treatment plan. Are you pushing really hard for your treatment plans once you present them? Or are you sort of letting them go a little bit? You present it to them, the doctor doesn't go for it, you don't pursue it too much. A lot of different alternatives. But are you pursuing them? This is an area that doctor can improve on. Marketing and advertising. Explain to the doctor you really haven't been doing much marketing and advertising. And there's an area of growth. Referrals. It's probably one of your biggest things. Be very clear what you are referring out of the office, especially endo, perio, oral surgery, implant surgery. You're referring all that out. You're talking about a lot of money that could be kept in-house. At least, I estimate at least a 20-22% increase. So you could really do well with that, okay? Please think about that. Get that message across to the doctor. Here's what you could do. Here's how you can grow the practice. Keep everything in-house. Increase the growth by 20%. Now, you buy a practice, it generally goes up by 10 to 20% depending on size, if you're doing everything right. That's the national average. But if you keep things in-house, you could have a big increase in your gross collections. You have to work a lot harder. Big increase in your gross collections in the first 60 days. I had one of my doctors did that. They actually went up 20% in 60 days. Unheard of. Excuse me. So it can happen, and you can do it. So just think about that. That really, it can happen. That's one of the biggest topics. If you're going to forget everything else, you got to stress to the doctor how you take this practice to the next level, and what you're not doing. Marketing, advertising, pushing for treatment plans. Another one is staff bonuses. Are you doing staff bonuses? I'm not. I feel it incentivizes the staff. All of a sudden, a patient coming in for whitening now is going to get veneers and laminates. So there's a lot to grow there, and a lot to communicate about. Then, of course, you walk them through with the equipment and so forth. At the same time, we're there. We'll stop periodically, see if they have any questions. Do they need any capital investment? I just came from an office. There was nothing needed. I don't know what you would put money into. I didn't see anything. And it presented really, really well. And you also give confidence to the doctor. Give confidence that you will stay on to try to help. As long as the practice isn't too small, then it's hard to pay for two people. There's enough funding there. You got to practice over 800,000. You could at least keep two people somewhat busy. Maybe the seller can be reduced in their amount of time. The buyer has to produce, at least 70% of the work. But there's a lot that you could grow to the next level. And the buyers always like to hear, it's virtually all the time, want to hear that the seller wants to stay on. That gives them how long they can stay. Well, the seller has to cut back dramatically, since the buyer, as I just mentioned, has to do 70% of the work. But still in all, it's an experience. You're getting to know each other. The doctor, the seller is getting to know the buyer. And remember that story I told you. Sellers always want to sell to somebody within reason of the financial offer. They always want to sell to somebody they feel more comfortable with. Always. Never seem to vary from that. Some are looking for only the top dollar and that's it, but a lot of them do that. So just remember that. Okay? Now, there's a lot of other topics that you as the dentist, as the seller, know about your practice that you can share. But not everybody's going to know things you can point out. At the same time, you want to periodically stop and say, doctor, do you have any other questions? Is there anything? How long you should speak to the first-time buyer of a dental office? I usually stick with 40 minutes to an hour. When you go over 1 hour, first of all, you don't know if this buyer is going to buy. I just came from one, they did 2 hours. They were like horse at the end. I'm like, I don't even know if this guy's going to buy it. I mean, 2 hours, the buyer should have a feel for it. Remember, most buyers are looking over your financials before they come. They send it to their accountant, their bank, etc. They've already done that. So, there's a lot there. Analyze before you get there. And as I've always told you, the buyer that comes in on day one at the office and is super excited at the office itself, that's an omen. Generally, they don't buy it, believe it or not. But if they leave the office and the next day they call it, now they slept on it, if they're really excited, within 48 to 72 hours, they'll call. They don't call, not interested. So that's just something to be aware of. Okay? You go easy. You don't want to push too much. You want the doctor, the buyer to ask questions. You don't want to pin too many medals on yourself. You don't want to tell them that or her that you have patients flying in from all over the world. Because the first thing they're going to think about is, well, those patients aren't going to come when I'm here. Most patients come from 3 to 5 miles out. If you have an extraordinary practice and they come from very far away, you don't want to push that too much. Buyer's going to be afraid that, obviously you want to show them a demographic study, but buyer's going to be a little afraid that, there may not be the retention, but the retention is very high. That's why doctors and their banks take only 100% of the final sale price. Very high retention. All right. So that's just a quick summary analysis for you. How you handle yourself on the first visit. Thank you for listening. Call us anytime, and we'll be more than happy to talk to you. All right. Hit the like button and you'll get updated with all the videos. I think I did 4 or 5 this week. I think well over 650, I think now. Bye.